Hi, my name's McEntee, and I'm going to be presenting on an audit of inhaler therapy and its environmental impact in the ICU in St.James's Hospital, Dublin. So, a bit of background. So, healthcare contributes significantly to greenhouse gas emissions, making environmental sustainability an increasing priority. Anesthesia itself has led many healthcare sustainability initiatives. However, the environmental impact of inhaler therapy is much less researched. Regarding inhalers, so pressurized metered-dose inhalers have a high carbon footprint due to the propellants that they use. And in Ireland, inhaled medications account for 4% of healthcare emissions, with pressurized metered-dose inhalers representing around 60% of our prescribed inhalers. The ICU itself is a high resource clinical environment where inhaler prescribing may provide opportunities for medication stewardship and reducing carbon emissions. So the overall aim of this audit was to quantify inhaler use in the ICU and estimate its associated environmental impact. A bit about the study. So the study was a retrospective audit. We conducted it over a 1 year period, looking back on patient electronic records from the ICU. All patients that received inhaled therapy during their time in the ICU were included in the audit, and we collected variables such as patient demographics, inhaler types, and doses administered. Carbon emissions were estimated using published life cycle carbon footprint data, and we calculated their environmental impact based on two models. So a dose-based device utilization, so dividing the total amount of doses and how many doses one inhaler can provide, and then one device per patient, which accounted for potential wastage or not giving a complete inhaler dose. So regarding our results, so total patients that received inhaler therapy was 343 patients, and of that, 93% were prescribed salbutamol. So salbutamol was prescribed to 319 patients. Because of the overall predominant use of salbutamol, we calculated the environmental impact of salbutamol MDIs versus nebulizer equivalent. So based on minimum device use, so the total amount of devices or the most minimum amount of devices that could have been used, got 953 kg of carbon emissions. Then if one device per patient was used, which would have been our maximum amount of carbon emission from that total amount of doses, we calculated 8,584 kg of carbon emissions. And this combined, when we compared this to what carbon emissions from the nebulized salbutamol would be, there was a huge difference. So 287 kg of carbon emissions would have been accumulated if nebulized salbutamol was used. So overall, inhaler therapy represents a modifiable source of carbon emissions within the ICU, and optimizing our prescribing practices and reducing necessary continuation may provide opportunities for more sustainable respiratory care